Hello, welcome everybody. I'm Hillary Siebens, a volunteer physician with Kappa for 19 years. My field is geriatric medicine and rehabilitation medicine. I'm calling in from Seal Beach in SoCal and trust that you all have a delicious drink. Please sit back and relax. Now, housekeeping. If your video and or sound is off or doesn't quite match, reload and refresh your screen by tapping on the little circle or arrow symbol in your browser. Or you can copy your current link and place it in a new browser window and then close your prior window. And also just a reminder that Kappa is a 501c3 nonprofit organization under the IRS code. We are prohibited from participating in any political campaign of candidates for elective public office, yet we can advocate for causes we believe in. Thank you for joining this, our 9th Kappa annual Medicare anniversary celebration. Pre-pandemic, we gathered in Oakland, Fresno, and LA, and we certainly look forward to being able to gather in person again. Now, Medicare is 57 years old, having become law in 1965. It provides health insurance for those 65 and older and those with disabilities. That same year, Medicaid, called Medi-Cal in California, was established to provide health insurance to those with very limited incomes. And since 1987, Kappa has been advocating for a universal healthcare, single-payer Medicare for all system in California. And Kappa's been advocating for this alongside our student program, the California Health Professional Student Association, or CAPSA. We all believe that healthcare is a human right, and we know everyone needs healthcare. Today, we've got very dynamic speakers to share what's being done at local, state, and national levels to achieve a Medicare for all healthcare system. Now, a huge thank you to our patrons. These are Doris Herzog, Paula and Barry Litt, Steve Tarzinski, Robert Vanetz, Susie Baldwin, and Christopher Cherney. And also a thank you to our event champions, all listed here: Bernie Nadell, Daphne Dennis, Janet Winikoff, John Lee, Parker Duncan, Arnie Gass, Bernie Nadell again, and Indu Subaya, Leslie Bruce, Bruce Hector, Patricia Silver, John Lee, Daphne Dennis, and Yelenia Palacios. Thank you, thank you, thank you. And now I'd like to thank first all of you viewers on Classy right now, on Facebook and YouTube, and thank you to all of our donors. Now, here's our executive director.
Good afternoon, everyone. My name is Beatriz Sosa Prado, and my pronouns are she, her, hers. I'm Kappa's executive director, and I am joining you today from my home in LA. Today, we celebrate Medicare's 57th anniversary. Thus, our fundraising goal is $57,000. And I want to tell you how much I do love Medicare. And though I'm not a beneficiary myself, many people that I love are. At 61, my father became permanently disabled after suffering a massive stroke. And because of that event, he was eligible for Medicare earlier than most. Last year, he passed away, but I remember how he lived. And thanks to Medicare, my father received the care he needed to control his diabetes mellitus for the last 17 years. And near the end of his life, thanks to Medicare, he received home hospice care until the day he had his last breath. My mother is also a Medicare beneficiary, and every day I'm grateful that she has an excellent doctor and receives the care and preventive services that she needs and deserves. But it wasn't always that way, right? Before she turned 65, she spent years and decades since we came to this country without seeing a regular doctor. And she relied on California's safety net. I remember going with her for hours, sometimes the entire day, to community clinics so that she could see a doctor one day, a different doctor another day, and in 3 months, another doctor. And our family celebrated so much when she turned 65 because we knew that she was then going to receive Medicare. And she has been aging with dignity, and she has, and the family also has, we have this reassurance that she now has a reliable, adequate medical care. And this is the right that every American deserves because healthcare is a human right. And to those who are new here to Kappa, welcome. Let me tell you briefly about Kappa. California Physicians Alliance mission is to advocate, educate, and organize physicians and other health professionals to support creating a socially just and universal healthcare system that ensures quality and accessible healthcare for all of us who call California home. Our vision at Kappa, and we've outlined this in the document, which is the roadmap to Golden State Care. It's a document that was published in 2019 and will be updated. It was updated last fall and will be updated again this summer, 2022. There, we talk about our vision to create and fully implement Golden State Care, which is a unified public financing system for California. Golden State Care would cover all necessary health costs. It would finance the delivery of our health care while building upon current private networks. Golden State Care would cover all Californians from birth to death, and it would be unlinked from the place of employment. And thank you again for celebrating Medicare with us today. Let's continue to protect this great national program, and let's continue to improve it. We are all important. Our voice is needed, our vote definitely, and our actions are needed. We need you to participate in Kappa. We need to come together so that together we'll continue to build this momentum and power that this organization can do to achieve healthcare, the healthcare system that we need and deserve. And so thinking about this healthcare system that we so desperately need and want, let's imagine it. What is it going to take for us to get there? Sure, we've had countless conversations about this for the last years and decades, but California Physicians Alliance has the potential to be that one organization who is progressive and is demanding healthcare for all. Ideally, and Kappa was founded with the mission or with the vision of having a national healthcare system in the United States. But over time, we've decided to narrow focus, and work on our state first, because California is a leader in this nation. And we have the potential to create a universal healthcare system here and to continue being the model for the rest of the nation. But it is not an easy task. We all know this. We have a small staff, and that is why we need you. We need your support to participate in our legislative actions and or to donate generously if you can. Your financial contributions keep us alive and working towards making legislative improvements in our current system until we can achieve single payer in this beautiful Golden State. I'm so grateful for your time and your attention today. Enjoy the program. And now it is my pleasure to present to you Kappa's president, Dr. Steve Tarzinski, who is also the chair of the Kappa Board of Directors and who does a tremendous amount of work for this organization. I don't have the words to describe them, but I'll have the opportunity to talk about him at another event. In the meantime, we'll get his image ready, and here is Dr. Steve Tarzinski.
Hello, everyone. I'm Steve Tarzinski, president of Kappa's Board of Directors. I'm joining you from Santa Monica in Southern California, and welcome to our 9th annual Medicare anniversary celebration. As we slowly emerge from the worst of this COVID pandemic, Kappa continues to be fully engaged in advancing healthcare reform in our state and the nation. Importantly, we've grown our staff with 3 new young and talented full-time people. In addition, over the past year, Kappa engaged intensively with the official state Healthy California for All Commission. This commission issued a report which outlines a plan on how the state can get to a unified system of financing, including a single-payer system. The report is now in the hands of the governor and the state legislature, and Kappa continues our efforts to make sure that the report is translated into action and legislation. You'll be hearing more about this when Dr. Mark Galley, who chaired the commission, speaks later on in the program. But please know that the commission was formed partly due to invited testimony that Kappa gave in 2018 to the Assembly Select Committee on Healthcare Delivery Systems and Universal Coverage. Also in the past year, Kappa updated and continued to advance our own Roadmap to Golden State Care, which details step-by-step how California can actually get to a single-payer system, something which no other organization has done. The roadmap can be accessed at our website. We are actively also engaged in achieving Medi-Cal coverage for the remaining income-eligible undocumented people in California. This will bring California to 96% coverage by 2024. 96%. Remember that Kappa was a lead organization in achieving Medi-Cal coverage for undocumented children, which broke the decades-old logjam for covering all income-eligible undocumented Californians. Going forward, we'll also be part of the effort to protect reproductive rights in our country and in our state, alongside our coalition partners. As to our reason for being gathered here today, the establishment of Medicare in 1965 was a key step in advancing towards universal coverage in our country. It's fitting that we mark each anniversary of Medicare's passage into law as we work to expand it for all. And although California will achieve 96% coverage, there are still plenty of challenges like equity, disparities, access, affordability, resource waste in a system still dominated by profit-seeking private insurers and increasingly threatened by the massive intrusion of private equity, workforce diversity, and the well-being of we the caregivers ourselves. There's still much work to be done. With our new staff and new specialized software platforms, this year Kappa will complete 2 mapping projects, mapping our membership by legislative district and by medical specialty. This will significantly enhance our impact. Our ambassador program, completed this year, will train and deploy expert health policy speakers. We continue to develop our business outreach project and will cultivate business and labor sponsorships. We continue to expand and diversify our board as we transition to a new emerging generation of leadership. Our major focus will be to build our dues-paying membership and our supporter base through these activities and through more direct outreach to California's physicians now that the pandemic has somewhat receded. And as we have always done since our founding 35 years ago, Kappa continues to work with our partners on a range of short and medium-range reforms that will improve access, quality, affordability, and equity now in our state's healthcare system. All this as we keep our eye on the ultimate prize of single payer, a unified system of public financing. So in closing, we count on your sustained generosity to help in all this good work. Please know that you're not merely giving to Kappa, but you're giving through Kappa to realize your own values as well. Thank you for your time, your efforts, your financial support, and for being with us today. Thanks also to our hardworking staff and to our speakers. Enjoy the program. And now I'll turn us over to Dr. Bill Tarrin. Thank you.
Thank you, Steve. Let me get this out of the way right away. You can donate to this event by clicking on the donate link on the left panel in the chat. If you are joining us via Facebook, the donation link will be posted in the chat. And if you view us later on YouTube, the donation link will be posted in the description below. Hi, I'm Bill Tarrin. I'm the treasurer. of Kappa, and I'm a pediatrist with the San Francisco Department of Public Health. And 3 weeks ago, I had a patient come in who had foot pain for well over a year, but had never sought treatment for that pain. And when I inquired why, she stated, because I do not have health insurance. I said almost flippantly, well, now you have health insurance, and here you are sitting in front of a pediatrist. Her exact words after that were, I think I'm going to cry. Well, I'm glad she didn't, because as I told her, if she cries, I cry. Then I thought, they're not crying in Spain. They're not crying in England, Germany, Canada because of lack of health access, Italy. Well, maybe they cry a little bit in Italy, but not because they don't have health care. It's because, as you well know, those countries have a social contract that is humane. Everyone who lives there gets health care, period. Care is not delayed. You're not encumbered by the emotional, physical, and financial stress of not having health security. Yes, we are making progress. More Californians are insured today than they were just a year or two ago. And frankly, if we may boast, in large part due to the advocacy of organizations that you support, like Kappa, our allies and alliances who organized and mobilized and pushed for additional coverage for uninsured residents. Indeed, most likely that is why my patient with chronic foot pain finally got to see me. But our job with Kappa is far from over. You know, we still operate in a healthcare system that is Byzantine, complicated, overburdened with administration, that still has a large minority of people being underinsured and thus not being able to afford care, similar to my patient. A healthcare system that is a burden to businesses, whether they know it or not, including forever deferment of increased real wages for their employees to keep up with everyday cost, a continuing lack of primary care, which we all know should be the centerpiece of our healthcare system, still suffering from racist and economic inequalities, and on a medical economic level, still a strain on the healthcare staff, medical practices in terms of dealing with dozens of health insurers with their own rules, formularies, data collection, and payment systems, all increasing necessary costs when they should be unnecessary and be directed to patient care. Then there's the unscrupulous dealings of private equity buying up medical practices with the sole purpose of returning a profit at the expense of improving their bottom line. At the expense of improving the healthcare of the community, rather. Let me make this very clear if I haven't already. We are nowhere near where we want to be in our healthcare system in California, the country. There is a lot more work to be done, and we want you to know that Kappa is all in. That's why this year we are taking the greatest yet confident leap of faith in our organization's 35-year history. As Steve already alluded to, we went to great lengths to hire additional qualified staff so we can compartmentalize the work that needs to be done and make us more efficient. We invested tens of thousands of dollars in upfront costs for technology to take us to the next level of organizing and mobilizing, because we agree with longtime organizer and strategist Jane McAlevey when she states emphatically that systemic grassroots organizing is the key to regaining today's ravaged democracy. Now substitute democracy for healthcare. We need to reach out to our allies and those who don't know that they are allies, doctors, including specialists, small and large businesses, and most importantly, the general public, so we can organize and mobilize to reach our goal of publicly funded single-payer healthcare. Kappa is all in, and now we need you to be all in too. We need you to support the work we are doing to advance healthcare justice. We need our non-members on this call to become members. And we would love if you would become sustaining members, like those of us on the Kappa board and others, because sustainership allows us to have much improved financial predictability and stability. Please consider making a donation that makes you just a little bit uncomfortable, because in the end, it's like a vaccine, temporary discomfort for long-term good health, community protection, and overall good welfare. I thank you for your trust in your care and your healthcare advocacy organization, Kappa, in doing the work that's important to all of you. We appreciate your financial support and otherwise. Like always, we'll be hard-working fiduciaries of your financial commitment, spending both thriftily and wisely where we have the most to gain for the battle of healthcare justice. So make a donation today, and as my Aunt Helen on my wife's side used to say, don't make me cry. Thank you, and enjoy the rest of the program.
Thank you so much, Dr. Taryn, for those wonderful messages. Dr. Taryn is our board of directors treasurer and has served Kappa for many, many years. For our first speaker today, I want to introduce Dr. Ilan Shapiro, also known as Dr. Shaps. Dr. Shapiro's passion has always been to improve the community of the health of the community, and to convert health information into action, improving the well-being of the communities that he serves. Born and raised in Mexico City, I too was born in Mexico City. His experience as the liaison between Mexico and the World Health Organization after medical school taught him that healthcare systems need to be connected with the most critical aspect, which is the community. He began his journey in policy and advocacy as a pediatric resident at Mount Sinai Children's Hospital in Chicago. Dr. Shapiro regularly appears in several national and international outlets such as CNN, NBC, Telemundo, Univision, Estrella TV, and on the radio. And he shares so much information about emerging healthcare topics, and of course, including COVID-19, specifically on children's health. He continues his journey in policy and advocacy by contributing as a board member to California Physicians Alliance. And he came on our board last summer. I personally love Dr. Shapiro. I love getting his medical advice and fun and healthy tips on social media. He definitely is someone to follow. And so with that, I am honored to introduce our board member, Dr. Ilan Shapiro.
Familia, it's a pleasure to be here. B, thank you so much for these welcoming, amazing remarks from myself. I'm going to record and I use it every morning. That way I can actually wake up even happier. Well, Familia, I'm going to tell you a couple of things in two stories. One is true, the other one isn't. And at the end of whatever I am telling you right now, you will actually choose which one it is, and I will tell you a secret afterwards. Coming from Mexico City, coming from Mexico, and actually practicing in both sides of the border, I have seen the difference of taking care of ourselves. And right now, specifically with the community that I serve here in LA and Orange County, I have seen the disparities, and especially with COVID-19, on what can actually happen to a community. Probably a lot of you have wondered, why are Hispanos and underserved communities worse right now? Why were they affected so much? And I can tell you for sure that there's a lot of reasons for that. And a lot of the times there were answers like, well, the virus is actually mutating and there's a genetic code and there's something bad that they are doing. And so many things that are completely not true. At the moment that we do not have access to healthcare, we have exactly the same results that we're having right now. And as you know, whenever someone comes to our clinics, and I will give you a specific example for an abuelita, for a grandmother that was with us. And that's part of the stories that I'm going to tell you today. She came in, she didn't have insurance, and I'm going to pause there. Why am I pausing? Because that's part of the true part of it. She actually came to our clinic, and thanks that she actually had insurance. The other way around, she will have gone to the ER, having problems with her diabetes, having problems being headaches, and they will go to the ER again and again and again. The ER is an amazing place where actually they can save your life, but they would not control your hypertension for years to come, or they will not evolve to a relationship with you to talk about your healthy habits. Or even if we go a little bit farther, they will not ask you if you have a house, if you're safe, if you can actually do something for your family. Those things are the reality of many parts of our community, where they're using ERs as their primary center of care. That's not fair. That's not fair for our patients, for that abuelita, That's not fair for the doctors or the system. At the moment that we are having all these things in front of us, we have a choice, a big one. Do we want to actually create that ending of the story, or have someone actually coming to your clinic, having a doctor that knows your name, building upon a relationship where we understand social determinants of health and the burden of actually knowing if they need to choose between paying for food or taking care of their diabetes would not ever be on the table. Why? Because they have access. Why? Because there's a doctor behind that door that will take care of them. Why? Because there's a system with amazing nurses, promotoras de salud, healthcare workers, and an entire army to make sure that her diet, the opportunities that she needs, and most importantly, seeing her not as the diabetic patient that walked in with A1C of 400, but Marta, Maria, Joni, that actually is suffering right now, and we will make sure that she's getting better. Right now, COVID 19 has shown us how important it is to have a stable system, how important it is to actually understand what's happening in the community. And when you add a pandemic to a chronic disease that has not been taken care of, where all the headaches of diabetes, hypertension, depression, anxiety, and all the amazing list of horrible things that can happen to someone, especially if you add that part that, well, I will go tomorrow to the doctor because I need to work today, or I simply don't have insurance, I'm not willing to pay, or I went to the doctor and I cannot pay for my medications. Then there's so much in front of us that we can do. Answering the question from the beginning, why underserved communities suffer that much? Because of lack of access, barriers, and that thing that it's called social determinants of health. Then all of us combined, and you just add a tip of a pandemic, you get the disparities, the problems, and the gaps of healthcare that we're seeing right now. Because of this, and because of the future generations that we can actually improve the healthcare from them, this is the moment to think and reevaluate where we stand with this. And you always have three choices. One, repost, share the information. Second, you can actually get involved. And third, be part of the change. As the world turns from one side and we do circles and circles around the sun, we always have the choice to make the world a better place and spin it or just watch it. That's why it's so important at this moment that we continue vaccinating our communities against fear with a dose of truth. And that truth is that we are humans. We need health care. If we want to be there for our familia, for our family, for our community, and most importantly, for the future of our kids, this is the moment that us, especially as physicians, we can start that conversation and improve the outcome and create some changes where we can participate, be equal, and be ready for the next pandemia. Because we have two choices again. If we continue the same thing, any pandemia or epidemia, and right now we have monkeypox and the first case in New York of polio, then if we have the same efforts and the same system, we will have the same results. I truly believe from the bottom of my heart that we can do better. And that's why me participating as part of the board, it's so important for me, because I want to be part of the change. And I invite you all of you to be joining us in whatever position, donation, support that you can actually give us, because right now is the time to change. Thank you so much. And in the moment that I'm talking, I will sing La Bamba. That way you can actually put me over there. Oh, there we go.
That is just fabulous, Dr. Shapiro. That's great. Thank you for all of your energy that you bring into medicine and healthcare and the movement for healthcare justice. Truly, your words and that energy, that vision that you have, Dr. Shaps, it really does support the organization and it supports the world. I want to thank you as a mother myself. All of the advice that you put out there on your social media channels is inspiring. It's so important. It's educational and it's needed. You are needed. And so shout out to all of the pediatricians out there, including our board president, Dr. Steve Tarzinski, who is also a pediatrician. As of May 1st, all income eligible adults ages 50 and older, regardless of their immigration status, became eligible to apply and receive Medi-Cal. Thanks to champions like Senator Maria Elena Durazo, the author of SB 56, the Medi-Cal expansion for seniors, Health for All bill, this became a reality on May 1st. So California Physicians Alliance is part of the Health for All Coalition, which is comprised of dozens of organizations across California that advocate for health equity for our undocumented Californians. And this journey to get seniors included in Medi-Cal began, I believe it was in 2019, late 2019. And we've been through several hurdles to get that passed. And as I said, as of May 1st, the governor expanded Medi-Cal, and all thanks to champions like Senator Durazo and others. We are honored to have her join us today. Senator Durazo's district encompasses various LA neighborhoods. In fact, the Kappa office is in her district, District 24, near downtown LA. And for those of you Angelinos, you will know, well, you all know downtown. And so our office is actually on Wilshire and Lucas in a little corner right there. So now back to Senator Durazo. She represents more than her district. She represents all of the immigrants and working people in California who clean our hospitals and clinics, hotels, convention centers, the people that cook our meals and staff our airports and sports arenas, and I can go on and on and on. You know who I'm talking about. Senator Durazo began her career as a migrant worker with her family and became an organizer with the International Ladies Garment Workers Union. That union became the Union of Needle Trades, Industrials, and Textile Employees, or UNITE. And within a few years, she led the transition of Hotel Workers Union, that is called here Local 11, to become more responsive to its majority Latino membership. She became an international vice president of Unite Here, a merger of the two unions. Senator Durazo was the first woman to lead the LA County Federation of Labor, where she and her team put together a program to sign up union members, their families, and their friends for the initial rollout of Covered California. I am inspired by Senator Durazo, and I'm just hearing myself say that that's a great activity that Kappa needs to do to continue organizing our members. And now back to Senator Durazo. She was the vice president of the Democratic National Committee and national co-chair of the Barack Obama presidential campaign. She is a national leader for guaranteed healthcare for all. Together with Assembly member Joaquin Arambula and others, she led the fight in California to expand Medi-Cal coverage to undocumented seniors, right? And which is consistent with Kappa's roadmap to Golden State Care. And I am so proud to introduce an excellent role model for me, Senator Maria Elena Durazo. Thank you so much for being here and for joining us. I'm delighted to have you.
Thank you. Thank you very much. Well, I'm really glad and happy to be here. Thank you for the invitation. Been with you in the past as well. Thank you, Beatriz. Thank you, Dr. Tarzinski. And as you mentioned, I want to say at the very beginning to my colleagues in the legislature, especially Assembly Member Arambula and Senator Lara, who had begun the whole battle to make sure that undocumented were included, just like any other Californian. We are all in this battle, in this fight for quality, nothing less than quality, accessible, nothing less than accessible, and affordable health for all, period. And I want to thank you all for being in the leadership of that fight, because it is. Your organization and your individual members have done so much to bring forward this, our cause and to take it to new levels. Your individual members have shown so much sacrifice and bravery in response to the COVID-19 pandemic. You have provided both public voice and a behind the scenes voice on how to respond to the pandemic in the most fair and just way. And because everybody was scrambling around, because we had these inequities prior to the pandemic and into the pandemic, we needed your voice. It both had the quality that we all needed, as well as the heart and soul to reach every single Californian, regardless of color, status, it didn't matter. Just reach everybody. So I thank you for that. And just, as we should always reflect on those that we lost on the front lines and be thankful for being present today. The disparities are very, very clear in our healthcare system. The disparities are very clear. They reflect of our society. But the most glaring to me has been the exclusion of undocumented Californians. Undocumented brothers and sisters were precluded and excluded not only from the healthcare system, but from wage replacement programs and to the safety net programs. They were not properly accounted for in the testing and the treatment plans for COVID-19. This is a very cruel part of the medical system in California. And we are the best of the best in the country. And I say that very clear with great pride. But imagine having this virus spread and spread and spread while people were expected to go to work. People were expected to go into the fields and pick the crops. People were expected to transport the products that we needed to survive. They were expected to go and still take care of families by being the nannies and the domestic workers. All of this was expected of them. Put your lives on the line. But we didn't have exactly the same protections for them as they were having for us. And the fact is, they were contributing, they continue to contribute billions of dollars into our system, but still were denied health care. That's no way to treat any human being. So the great news is, as Beatriz said, we have turned around one of these very big, serious inequities. We have a historic commitment in the state to by no later than 2024. I say no later because we're working really, really hard, all of us, to get it done way before 2024, to cover the remaining gap of undocumented Californians. So all of those between 26 and 49. That alone is approximately 800,000 Californians that could be eligible. I'm very excited about that. I'm very proud of our coalition that has brought this together. I'm grateful that Governor Newsom and the administration came through on that. So it's a huge deal. But we have a system that still is difficult for people in spite of the fact that they're eligible to trust. And so we have to continue to work very, very hard to make sure we actually reach everybody, and not only have it that they have a right to it, but that we actually reach them. And that's going to make all Californians much, much better off. So again, I want to thank everyone who made this a top priority for the state. When I was elected and went in December of 2019, Senator Lara, asked me, if I would take the baton to the next step, and proudly have done so alongside so many others. We also need to continue to work together to make sure that the system is there to get everybody actually, in fact, included. And then we also have the assets test that will be removed from this group in June as well. We hope this expansion will happen ASAP. So again, I ask you to keep on working on this. And I want to also say, with regards to another issue, we should take it up much more detail, and that is the diversity of the healthcare industry and healthcare professionals. We really need to do that as part of building trust in the system. There's an opportunity to build out more and make that pathway to those careers more accessible to youth and to people of color, to working class, to the poor. There's no reason why they should be denied the opportunity to those careers. So whether it's more funding for certain ones of the UCs like Merced, there's a lot of ways. I know that you have experience with this, but we have got to get past the fact that we have very undiversified, non-diverse healthcare system, and we've got to do a better job. Finally, I want to urge us all to work hard to make access to reproductive rights, reproductive health care a priority. Again, we will stand out as California. We will stand out as protecting healthcare and protecting those people who want to come into our state for healthcare, reproductive rights, and the right to abortion. And part of that is, I'm saying this personally, as a state senator as well, and our Senate Democratic Caucus priority is to pass Prop 1. That's how we're going to make sure that we have made it part of our Constitution, that we truly have health for all on every level, including the right to decide, for a woman to decide when she wants to get pregnant and whether she gets pregnant at all. We have a lot of work to do on that front. I urge you all individually, I don't know how you can do as an organization, but we have to pass Prop 1. We have much work to do. We have to connect our health care for all to our civic engagement efforts. We have to change our system. We cannot be beholden to corporate control of our healthcare system. So again, sisters and brothers, I appreciate your extraordinary work, and I thank you so much. Muchas gracias.
Thank you so much, Senator Durazo, for those words. As an organization, there is a lot that California Physicians Alliance can do in support of Proposition 1, which would include reproductive justice for California women and people that can get pregnant. And because having access to reproductive care is a value that Kappa holds. And we will defend a person's right for reproductive rights whenever they want to become parents. And Senator Durazo also mentioned about protecting and focusing, investing in our healthcare workforce. The California Physicians Alliance roadmap also focuses on the healthcare workforce, right? The workforce of physicians, doctors, and nurses, and all of the other healthcare professionals that are working in our current healthcare system and beyond, who will work in a single payer system or in a universal healthcare system in the future. And that's why we focus and invest in our student organization, the California Health Professional Student Alliance. Thank you so much, Senator Durazo. It was a pleasure having you join us today. And so for our next speaker, I'm also very excited to introduce Assembly Member Ash Kalra. Assembly Member Ash Kalra represents California's 27th District, and this is his second time appearing in our Medicare anniversary event. And it was very important for us to have Assembly Member Kalra join us to talk about the work that he is doing at the state level for healthcare justice. But let me tell you a little bit more about him. His District 27 encompasses approximately half of San Jose, and it includes downtown as well, San Jose area. He was elected in 2016, becoming the first Indian American to serve in the California legislature and in our state's history. He was reelected to his third term in 2020, and that is something to celebrate. Assembly Member Kalra is the chair of the Committee on Labor and Employment and also serves as a member on the Housing and Community Development, Judiciary, Transportation, and Water Parks and Wildlife Committees. Last year, he was elected by his Assembly colleagues to serve as the chair of the California Legislative Progressive Caucus to help guide a strategic, thoughtful approach to advancing our compassionate and creating an inclusive agenda for Californians. He has established himself as a leader on issues ranging from criminal justice reform to environmental protection, and has championed legislation on healthcare sustainability, housing affordability, growing transportation infrastructure, and expanding economic opportunities for all. Wow. And in the State Assembly, Assembly Member Kalra has authored successful legislation promoting secure and peaceful communities for all residents, and including protecting and preserving civil rights and civil liberties. And he has dedicated his tenure in public service to equity and social justice issues. To confront racism and systemic bias in our systems of justice, he also authored the historic California Racial Justice Act of 2020, AB 2542, a landmark bill addressing racial discrimination in criminal sentences and convictions. As a long-standing supporter of single-payer healthcare, Assemblymember Kalra last year introduced AB 1400, the statewide legislation also known as CalCare, which would guarantee comprehensive, high-quality healthcare for all Californians as a human right. He previously served on the San Jose City Council for 8 years and was formerly a deputy public defender of Santa Clara County for 11 years, representing dozens of felony jury trials. And as a public defender, he represented indigent clients in both felony and misdemeanor matters, and a majority of his time was spent in drug treatment court, where clients were given the opportunity to complete rehabilitation program and turn their lives around. Assemblymember Kalra was born in Toronto, Canada, and moved to our state as a young child. I did too, residing in South San Jose neighborhood where he grew up. Though, as I mentioned, I was born in Mexico City, and then I moved to California as well when I was a kid. Assemblymember Kalra received his Bachelor of Arts degree in Communications from UC Santa Barbara and has a law degree from Georgetown University. And it is my pleasure to introduce to to you today, Assembly Member Ash Kara. Welcome. Thank you for being here.
Well, thank you so much to Kappa's Executive Director, Beatriz Sosa Prado. Thank you for the very kind introduction. I think all of you probably know more about me than most of my friends now with that very generous introduction. And it's wonderful to be here, particularly with Senator Durazo. I don't think it can be overstated how significant her work has been in terms of expanding access to healthcare to everyone in our state, to all of our undocumented residents. It's something that the governor certainly had been working on, but it would not have happened at the pace that it's happened without the leadership and persistence of Senator Durazo. She's certainly one of the most effective, I believe, elected leaders in the nation, and I think is showing that in her work in Sacramento. And I want to really thank Kappa and congratulate Kappa in terms of your work in the last 57 years. If we think about since Medicare, the continued work to ensure that everyone has meaningful access to health care. And there's no doubt Medicare was certainly a game changer for so many in our community, all of our seniors, people with disabilities. But it really, as Kappa recognizes, represents the beginning of work that needs to be done. And we're still on that long journey. But as we just heard from Senator Durazo, we are accomplishing huge or surpassing huge hurdles along the way in terms of making sure more and more in our community are covered and cared for. And so I also want to, I was very inspired by Dr. Shapiro as well, although it would have been nice to hear him sing La Bamba. Maybe he could do that next time. But I think that one of the things he said, health in the introduction and in his comments, the reality of having to have healthcare connected with the community. And we're so far from that right now. Because of the work at Kappa and doctors like Dr. Shapiro, at least we're better off than maybe we may have been in the past. But if you think about how our system is set up, it's not set up from the ground up. It's set up, as Senator Durazo mentioned, by corporations that are profit seekers that dictate how our healthcare is disseminated amongst our community. And if it weren't for folks on the ground, if it weren't for Kappa and the health professionals involved here, I could only imagine how much worse we'd be. But let's think about this during the pandemic. And I always say the pandemic did not create the inequities that we're seeing in our healthcare system. The pandemic has exposed them. And one critical data point that shows that, in the first year of the pandemic, life expectancy went down 2.7 years for African Americans, 1.9 years for Latinos. And some folks might say, oh, well, they may have pre-existing conditions that make them more susceptible. But as Dr. Shapiro pointed out, why is the question we need to ask is, why is that? Why are certain segments of the community having underlying conditions? Why is it that working class communities fare worse? In my district, the 3 zip codes in the entire Bay Area, the 3 zip codes with the highest death rates of COVID are in my district, predominantly Latino communities, working class folks that didn't have the choice to stay home, in many cases didn't have quality access to healthcare. And so, as was stated, they go to the emergency room if something urgent happens. Otherwise, they don't go at all. And when it comes to the pandemic, that's the worst possible thing you want for all of us in the community. And so, when we think about our healthcare system, I'm hoping that the silver lining of the tragic couple of years we've lived with COVID is that we recognize our system is broken. It's fundamentally broken. And that the data shows at least 300,000 people died that would not have died if we had a single payer healthcare system. So Kappa's understanding of this is so critically important. All of you have a voice that in many ways is much more powerful than mine. I'm speaking as an elected official. I'm talking about policies I'm advancing. But the physicians that are on the ground, those, the industry better than I do. You can speak to it in a way that's much more effective. And that's why not only should we be having these conversations, we should be supporting Kappa financially and otherwise, spreading the word, because the reality is that if we are going to make single-payer healthcare a success, If a bill like AB 1400 can continue to move forward, it will only happen with the movement. And the reality is the movement takes many partners, and a hugely significant partner in that movement are our healthcare professionals, our doctors, our nurses, those in the front lines, those running the clinics, those pediatricians and OBGYNs that are seeing patients falling further behind in terms of their preventative care and doing the basic things that they should do to stay healthy because they can't afford the deductibles. They don't have doctors near them. If they're on Medi-Cal, maybe they don't have the complete access in their own community. And that's why the steps we're taking and have been taking, for example, by providing universal access are incredibly important, but they're steps to a hopeful future in which we can ensure that everyone has complete health care and that it's not dictated by how wealthy they are, what their status is, what their race is, whether they're a man, a woman, transgender. None of that should play a role in the quality and the access to healthcare you get. I want to commend Kappa for the Golden State Care Program, because what that does and how that parallels with AB 1400, how that parallels with single payer healthcare is that it says a clear statement that our access to healthcare should not be connected to our employment. It doesn't make logical sense. It doesn't make fiscal sense for us to have it in that manner. And the reality is other countries us and mind-boggling that we connect healthcare directly to whether you're employed or not. And what that does is a couple things. First of all, it creates different tiers in our society. The better the job, the better the benefits, the better the healthcare. If you're a working class job, yeah, you'll have healthcare, but not the same quality of benefits. If you're unemployed, you won't have healthcare at all. You may be eligible for certain programs, maybe you're not. So what that does, it creates division when it comes to one of the most fundamental things that we should all be entitled to, healthcare. The other thing it does, and this is something I know that speaks to Senator Durazo as a champion for workers, it empowers employers and empowers the bosses over the workers. Think about this. How many times have you heard someone? I've heard it countless number of times in my life from my friends. They say, you know, I would try out this other position, or maybe I'll try a different career. I would do A, B, or C, but I can't because I can't lose my health care. It constricts and confines individuals, and it empowers their employers because the employers know that they can't just get up and leave because they're connected to their health care through that employment contract. And so there are a number of reasons why we need to push forward with healthcare. And I think one of the most fundamental reasons is that healthcare is a human right. And if we truly believe it, if we truly believe that, then we all have to continue moving together in the same direction, step by step, brick by brick, and make sure we get single payer healthcare in California. Because I believe, just like, you know, I had the chance to go to Canada, speak to some of their healthcare professionals there in different provinces. In Canada, it started in one province. In the US, it's not going to start in DC. Very few, honestly, great ideas actually start and begin and are founded in DC. They're started in the States. And California I have every reason to believe that California can do it. And the last thing I'll mention is, you know, actually 20 years ago, I almost drowned. I was in Brazil. And I was literally, a random surfer saved my life, brought me onto the shore. A helicopter took me to the hospital. And, you know, I spent the day in the hospital. They treated me. When I was leaving that evening, I went to check out. You know, I was in my swimming trunks. I didn't have my passport or any ID with me. They asked for my ID. I said, I don't have it. They said, you know what? It doesn't matter because it doesn't cost anything anyway. Now, sometimes friends will say, well, yeah, if it did, you could have probably paid for it. But that's not the point. The point, it doesn't matter whether I could pay or not. It didn't matter who I was. It didn't matter whether I was a foreigner or was from Brazil. It didn't matter. What mattered was they cared for me, and I was able to leave that hospital knowing that I could enjoy the rest of my trip because, well, I was alive, and I didn't have to think about, you know, a $10, $20, $30, $40,000 bill that I had to pay going forward. That's called dignity. That is called caring for one another and doing so in a way that's much more cost effective than the current system we have now, which is the most expensive system in the world, but far from the best outcomes. So I just want to thank all of you because you are helping this movement. You're part of of a movement. Europe and the movement is so critical that we're not going to be able to do it without you. So happy birthday to Medicare, and let's keep fighting to expand healthcare, expand Medicare, make sure that every single person in our state and eventually our country doesn't have to worry about going bankrupt. Number one reason for bankruptcy in this country, medical bills. Don't have to worry about going bankrupt, going homeless, or making tough decisions at the kitchen table as to whether they buy their medications or not. Let's get rid of that. Let's make sure the next generation doesn't suffer the way past generations have in our great state and nation. Thank you all so much.
Assemblymember Kalra, you were great. All of our speakers were great. And I just want to express how the words that you shared with us today about organizing physicians and that Kappa is here to ensure that we advance our healthcare justice movement, it really moved me. And I think all of our viewers feel the same way. Kappa is with you 100% on everything that you said, Assemblymember Kalra. Thank you for joining us today. Yes, doctors have unique voices and experiences, and Kappa is here to elevate their voices. And in Assemblymember Kalra's intro, I mentioned that he worked with the justice system, which we know that the justice system could be very unjust. And knowing that he did this work in the justice system is good for us to know. It's great to know, because Kappa believes that we must make significant investments in our public healthcare system infrastructure by also making drug use and its treatment that it should be, we believe that it should be managed through the public health system and not by the justice system. So, and drug use should be decriminalized. I love how you also, Assemblymember Kalra also highlighted some of Senator Durazo's comments. And I want to reiterate also what she said earlier, that the expansion of Medi-Cal let me backtrack. So on May 1st, we talked about how seniors are now included in Medi-Cal, right? May 1st, 2022. And currently, along with Senator Durazo and other legislators, our Health for All coalition has worked to push the envelope to get more undocumented immigrants included in our public healthcare system. And in June, at the end of June, Governor Newsom announced his budget for the next year, and he stated that as of January 1st, 2024, all undocumented Californians will be included in Medi-Cal. And now what I want to highlight is that as of January 1st, 2024, California will be the first and only state in this nation to include all undocumented immigrants in our system, and we celebrate that. That is just one success, one win out of the many that make California a leader in this nation. And like Assemblymember Kalra said, we get single payer to California, and then we expand it to the rest of the nation, just like Canada did. So our next speakers, for the next speaker, we have Dr. Latonya Hines. She is a board-certified obstetrician gynecologist at Kaiser Permanente West Los Angeles Medical Center. She is the former CEO of Girlfriends Medical Group, Inc., which is a private practice catering to the needs of women throughout Southern California. She received her Bachelor's of Science in Psychobiology from UCLA and her MD degree from UC Irvine, the College of Medicine there. She completed her surgical internship at USC. She obtained her extensive training and experience in obstetrics and gynecology from King Drew Medical Center here in the LA area in Wilmington. Her Dr. Hines is well known for being a great public speaker, a motivator, and a clinician in the greater Los Angeles region. She has a passion for giving back to the community through education and research. Many of her lectures have included menopause, cervical cancer, and the effects of obesity in pregnancy. Dr. Hines has been involved in medical education for over a decade through lecturing, acting as a preceptor, and mentoring medical students. She is also a Kaiser Permanente Bernard J. Tyson School of Medicine, Equity, Inclusion, and Diversity Advisory Committee member, and a clinical assistant professor there. Welcome, Dr. Hines.
Good afternoon, everyone. It is July 30th, 2022, and unfortunately, I am unable to be with you today. I am Dr. Latonya Hines. I'm an obstetrician gynecologist practicing perhaps about 22 years this year. I am an assistant physician in charge at the Baldwin Hills Crenshaw Medical Office Building for the mighty Kaiser Permanente. I'm also an assistant clinical professor at the Kaiser Permanente School of Medicine in obstetrics and gynecology, as well as assistant clinical professor at Charles R. Drew University. And I come to you this afternoon to talk about things that are really sacred to my heart. I was asked by a wonderful woman, Beatrice, who everyone knows she's near and dear to my heart, as well as Dr. Tarzinski, who is a mentor to me and has been wonderful all the time that I've been in Kaiser. And unfortunately, he has retired, but he leaves a legacy, especially with this organization, as well as what he's trying to do, which is to provide equity to every single Californian in this state to be able to get the kind of healthcare and the quality that they deserve, as well as to make sure that we are the template, I hope and pray, for the rest of the country in making sure that they provide adequate and excellent healthcare to all of the citizens in this country. I was asked to speak about 3 or 4 topics, but more importantly, I only got a few minutes. So with the excitement that I usually have and the passion that I usually have, I'm going to hit 3 things that I know are very important. Number 1, Medicare and Medicaid have been absolutely important in making sure that the numbers of people who are not insured through their jobs or personal insurance are able to get into the healthcare system and to get the healthcare that they need. When we think about diabetes, hypertension, obesity, cancer, these are disproportionately diseases that affect people with what? No access. People who do not know that they have access if they are not told, unless, of course, if they don't have a job. So the California legislature and this organization has been instrumental in making sure that that information is important so that there are millions of people in this state who have access to healthcare because of what we're doing with this organization, and more importantly, what we have done to advocate and lobby in the California legislature for good health insurance and access to as many people, we would like everybody to have it, as possible. The next thing I was supposed to talk about is that healthcare is a right. That's pretty obvious to me. The way that you breathe, the way that you live, the way that you function and pursue the quality and excitement in life, you ought to be able to go to see a doctor. And I mean any good doctor, not just somebody they want to send you to. And I think that that issue with healthcare and equity is so very important. Unfortunately, as an obstetrician gynecologist, you know what I'm going to talk about it. Roe v. Wade was overturned. I'm gonna let that sit for a moment because I know you guys understand what I'm talking about. And for those that don't agree, I got you. But what we can't do is allow the government to get into the relationship between a patient and the doctor. Now, on some ends, you have people that will argue about that and say that, well, that's what the government does. No, it's not. This is a fundamental right for women to control their reproductive health. And I know that for those who do agree with me, that it's very, very important that you be able to make decisions about your own life and to have access to the needs and the medical needs that you have. Next, if you don't agree, I still feel that you have the right to disagree, but not the right to keep people from having access to the healthcare. And I think that's really important because as we can see, if you just turn on your television, turn on your phone, not only are we talking about access to perhaps terminating a pregnancy if you wanted to, contraception, the right to determine when you want to be pregnant or not. And if somehow or another the pregnancy doesn't turn out to be perfect, whatever that might be, what do you do then? Is the government available to support the baby? Is the government available to support the woman? I mean, there's so much to that, but ultimately, what is it? A fundamental right of a patient to make a decision with access to every option available that she discusses with her doctor. That's what we're talking about. And that gets into the whole issue with both women and their power in the workplace, and more importantly, what happens when we're not there? We've had 50 years to try to make this discussion, and I feel like that's a no-brainer, at least for me. And so I know that I'm speaking for myself and obviously not everybody in the room. And the two last things is healthcare justice and during the COVID pandemic. Many of you perhaps may have seen me talking about This Is Our Shot, hashtag This Is Our Shot, a very wonderful grassroots organization that talks about what we can do to have a COVID-free world and also to increase the percentages of those who are vaccinated in this country. I think we as an organization made a huge difference. But I understand that there are people who didn't agree with the vaccine and still don't. But they still derive the benefits of what science and evidence-based care is. So I'm on the forefront of talking about what we can do to make sure that there is better health literacy in the country, such that we can have rational conversations about what it means to put science back into the healthcare arena and not a whole bunch of opinion and misinformation. And the last thing is that I wanted to talk about, because they say you can talk about anything you want, only got 3 to 5 minutes. And that is that each and every one of you did not get where you are by accident. That someone, somewhere, you stood on the shoulders, you listened to someone, and you had an opportunity and you took it. I beseech, I encourage, I persuade as many people as I can to stay passionate about healthcare and to do what you can individually to make sure that you have access to great care, that you reach back, reach to the side and make sure that someone else does, and that you can continue to purport evidence-based information, science-based information, and know that even when we think about places where there should be legitimized information that is not hearsay, CBS, the goal is to make sure that you are somebody that is as educated as possible to be able to refute the information and to give the truth about what's happening. I'm a strong believer that truth will prevail. I do hope that we will continue to be, I think, an exceptional country that provides exceptional healthcare, just not consistently and not to everyone. And I think we could do a lot better about that. I thank you all so much for giving me this opportunity to speak to you this afternoon. I'm sorry I wasn't able to be with you on July 30th, and I thank you so very much. Have a great rest of your organization's conference, and I wish I was there. Talk to you soon. Bye-bye.
Dr. Hines, we would have loved to have you also live in person. Thank you for your words, encouraging words, and we will continue to prevail and work hard, continue working hard to organize physicians and healthcare professionals across California. Our next speaker is Congressmember Karen Bass, who was reelected to her 6th term representing the 37th Congressional District in November 2020. She serves on the House Committee on Foreign Affairs and various other committees, countless of them. You can always go to her bio and learn about all of the other committees she serves. But I do want to highlight this, that she has served as the chair of the Congressional Black Caucus in 2019 and 2020. And during her tenure there, the Congressional Black Caucus worked with the Congressional Hispanic, Asian, and Pacific Islander and Native American caucuses to demand a targeted response to the COVID-19 pandemic in these communities. She also introduced the George Floyd Justice in Policing Act, the most transformative piece of policy legislation to ever pass in any chamber of Congress. Congresswoman Bass was a physician's assistant in the past, and healthcare is an issue that is very close to her heart as a Congress member and just as a citizen of the world. With experience working in one of the nation's largest trauma wards in the country, Congressmember Bass advocates and legislates with the goal of making healthcare a right and not a privilege. She believes that the richest country in the history of the world should not struggle to cover its citizens. And here she is. Welcome, Congressmember Karen Bass.
Hi, I'm Congresswoman Karen Bass, and I'm happy to be here with you today, even if it is virtual, to celebrate the 57th anniversary of Medicare. And it is great to say that Medicare is one of the most popular government programs probably in history. And I was elected to Congress the year after the Affordable Care Act was passed, and I can't even begin to tell you what those early years were like. I think I voted more than 60 times to protect the Affordable Care Act, when the Republicans wanted to abolish it. And for years and years, they said they wanted to repeal it and replace it, but everyone knows they never, ever came up with a replacement. And so the Affordable Care Act continues. I will tell you that when I got there, I was hoping that I would be able to participate in improving the Affordable Care Act. But one of the great frustrations was that we were never able to address it, so we weren't able to make some real serious improvements that I think would have helped strengthen the bill. But you know, I'm so proud to be a Californian because California actually sets the path for the rest of the country. And the California Physicians Alliance and their roadmap that they have developed that will lead to universal health care developed in California. We have a ways to go in California, but at least in our state, we are willing to do everything we can to provide health care to as many people as possible, even extending resources to people who are undocumented. So it's the 35th anniversary of the California Physicians Alliance, and I wish you well on your anniversary, and I hope that you continue to do the great work of moving our state forward, because in 2022, the idea that we are the only country in the world that has the economy that we do, developed country that has not, or I will say will not, provide health care coverage to 100% of its population is still an embarrassment. I hope we get there in California, and I hope that Kappa continues to lead the way in our state and hopefully around the nation. So, congratulations on the 35th anniversary, and I hope you have a wonderful time celebrating the 57th anniversary of Medicare. And we will continue to fight to protect Medicare and Medicaid and continue to push the states that still will not expand the Affordable Care Act. So thank you and have a great event.
Thank you so much for being here, Congressmember Bass. It truly is a pleasure. And thank you for being such a true champion of healthcare for all of your career. And that is decades. Thank you. We are honored to have you here today. And so for our last speaker, let me give you a little piece of information before I introduce him. At the end of 2019, Governor Gavin Newsom announced that the launch of his commission that is called the Healthy California for All Commission. And he appointed healthcare experts in business, philanthropy, academia, and labor to serve in this commission. The Healthy California for All Commission worked to develop a plan from January 2020 to May 2022 for advancing progress toward achieving a healthcare delivery system for California that provides coverage and access through a unified system of public financing, including but not limited to exploring a single-payer financing system. The commission prepared the final report to the governor and the legislature by May 2022. And so our speaker today is here to share with us about what is in store for us, California, after this report has been finalized and given to the governor. And just to clarify, no, it is not the governor, but it is Dr. Mark Galley, who is the Secretary of California's Department of Health and Human Services. He was appointed by the governor in 2019, and they work closely in around the same offices in Sacramento. In this role, Dr. Galley oversees California's largest agency, which includes key departments that are integral to supporting the governor's vision to expand healthcare coverage across and access across all California. Dr. Galley has worked in state governments and county and city and other private sectors to ensure that all Californians have access to resources and services that they need to lead healthy, happy, and productive lives. Before joining the governor's team, he worked for several years in San Francisco and Los Angeles, carrying out leadership roles. Dr. Galley is honored to serve in Governor Gavin Newsom's administration and looks forward to forging partnerships and relationships across California to make the governor's vision and our vision to make California a reality for all of us, right? And so now with that, I'd like to introduce you to Secretary Mark Galley.
What a terrific honor to be with all of you at Kappa, really leaders for such a long time, bringing health professionals together for what is not just a righteous, but a critical cause for our state, which is to continue to push forward the reformation, the transformation of our healthcare delivery system so that it is anchored in equity, that it's available to all, regardless of the situation that they're in, and that it pushes around affordability, quality, and really supports people, not just in supporting their health, but frankly, in achieving all their dreams and aspirations in a state like California, where opportunity is endless, limitless, and really up to us. So just want to take a moment to also acknowledge the amazing success of those federal programs that back in 1965, I'm not sure those who put the pen to paper to design what Medicare and Medicaid ultimately would be had the kind of vision that it has become. Obviously, throughout the pandemic, Medi-Cal has been transformative. It has helped so many Californians maintain the coverage they need to take advantage of access that really was changed itself with the flip on a dime to telehealth, the bringing together of so many new and different types of services for people during the pandemic. Yet we constantly saw that just the coverage of Medi-Cal wasn't enough. It was about the message. It was about the connection. It was about being able to encourage and support Californians who so often live without to come to expect to get the care they need to be healthy, whether that was in the form of testing, whether that was in the form of understanding the available clinical solutions to COVID infections and all of the pent-up demand, the delays in care that we're catching up for now. Medi-Cal, nearly 14 million Californians, 1 in 3 Californians, 1 in 2 kids, 1 in 2 births, 2/3 of all long-term care stays supported by Medi-Cal in California. This is not just another program. It is, in my view, a primary equity anchor for our state, and one that is actively being transformed despite the pandemic, the exhaustion. Our teams at the state, working with so many local leaders, plan leaders, physician leaders, healthcare leaders, and health professionals, have put together a vision for CalAIM, which not only begins to transform Medicaid at its core, it elevates the importance of social drivers of health, beginning to look at the whole person in just a different way, with the community supports that are now approved by the federal government as part of our Medicaid waiver. We have this amazing opportunity to not just serve all members in Medicaid, but those who have historically been overlooked, whether it's the justice involved, those experiencing homelessness, those in our foster care systems, those with serious and persistent behavioral health problems in new and I think innovative and impactful ways. And then that if that wasn't enough work, the transformation of our core contract, that compact between the state and the health plans across California that oversee and deliver on Medicaid. We've just put together the re-procurement, the procurement for the commercial plans in Medicaid to really up the ante, as I like to say, to raise the bar, to create a new set of standards around not just equity and quality, but transparency, clarity on what data we want, what data we're tracking, and what happens when we don't put our best foot forward. So really being able to support that work in that procurement, and the 1-2 punch I like to talk about between CalAIM and the reprocurement, I think propelling Medicaid into not just tweaks around the edges, but hopefully a brand new experience for so many Californians who need the kind of vision that I know Kappa not just supports, but helps form. Also just want to take a moment to thank Kappa, your leaders, Beatrice and others, who really got us to the place in California where we could have a Healthy California for All Commission. And not just that we could get it started, but that we could deliver on something that, although it's a step, and I don't want to oversell its importance, it was an important step for us. And I had a real sort of learning opportunity, a real privilege to chair that commission and work with a passionate set of advocates, a group of stubborn supporters of not the status quo, but a new vision for what California can and should deliver. Kappa's roadmap to Golden State Care obviously has many of these components, been thinking about ways to deliver in a pragmatic way, not just one big jump to a new transformed system, but the appropriate types of steps to take to get us to something that can really support Californians in a much different way with healthcare. I often say we pay through the nose for healthcare, yet so many of us aren't satisfied. So many of us wish it was done differently, that we could access it differently, that the providers who delivered it interacted with us differently, that we could have access to our data and a sense of what's going on in a more immediate and clear way. And all of those things, I think, are important tenets of that high quality, equity focused, affordable, cost-effective, and universal system of care that I know so many of you have worked hard to not just envision, but to make reality in your day-to-day practices, in the systems you work in your cities, in your counties, and at the state level. We know that this work is just getting started, that the work of the commission really propels us to get serious about our engagement, even more serious about our engagement with the federal government on where there's opportunities to create flexibility and opportunity for California, to reframe the conversation for employers and employees, for common Californians who don't necessarily spend all of their day thinking about how do we improve the healthcare delivery system to give me and my family what we need. That's really our job, and we should be humbled and privileged to take that job on. But how do we get those Californians to give us their thoughts, give us their opinions, and speak up about what they want? Because we know a system that is truly equitable and inclusive is created by those who are ultimately using and benefiting from it. So that work is another feature of the next phase of the commission work that we will see for moving forward, and that for the first time at the Health and Human Services Agency, we have resources to bring on staff, to bring on experts who can help us keep this work moving forward, to focus on the building blocks that we need to put in place for the system today, and obviously the transformed system we see tomorrow. I'd like to end by just humble gratitude for the recognition Kappa's providing me and our team for, frankly, being in the right place at the right time with the right leader and a governor who cares deeply about this, has his own personal and policy impacted views on how we can get this state to be a California for all, healthy California for all, and that includes focusing on the transformation of the healthcare delivery system. And so it's with that backdrop, I humbly accept the recognition that you're providing, and end by just thanking all of you, the voices of physicians and other health leaders. You're not just health professionals, you're health leaders. You do that every single day for your patients, for your communities. You're not just focused on what the lab value was or what the specific complaint of a individual is in your office or in the clinic at large. You're looking at these opportunities to really transform something, because we know health doesn't start or end with the exam room. It goes much more upstream. And in our work to transform healthcare, we know that it's an effort to transform health. And there's no better concept to embrace on the heels of this gross and ruthless pandemic, and one that we continue to suffer from in our state, in our nation, around our globe. And I'll leave you with a notion I share with my team frequently, that COVID-19 has not just been the great unmasker of inequities, it has been our great accelerant for change. And that change in the form of transformation of our healthcare delivery system is well underway. And Kappa's role in that is one that is greatly appreciated and depended on moving forward. So wish you well and success with the rest of your meeting. And again, thank you for the honor of being with you a bit today.
Thank you for being here, Secretary Galley. It really is our honor that you have dedicated time to address our Physicians Alliance. We would like to award you this certificate of recognition. And this certificate says, for our viewers, I'd like to read, it says, California Physicians Alliance proudly presents this certificate recognizing Dr. Mark Galley for his excellent leadership in California's health reform. As the chair of the Healthy California for All Commission, Dr. Galley was effective, inclusive, and exuded confidence in our state's progress toward justice in healthcare. Kappa was impressed with his tactfulness and professionalism. And this certificate is only so small for us to write how much we love Dr. Galley, and we want to recognize the efforts that he put into this commission and all of the work that he is doing for our state, for California's health.
Wow, what a broad cross section of speakers. It's just been fantastic. And clearly there's real momentum here from what everyone has said. So everyone here and that's listening to this incredible series of speakers, let's keep this momentum going. And how? Yes, please read our blasts. Next, email us with your suggestions and questions. Help us grow in our outreach and building this movement. And yes, we need financial support. If you've enjoyed the event, please donate something right now. You have the box right there on the left of your screen if you're in Classy. If you're on Facebook, there's also in the chat, as well as on Classy, there's the link to donate. Now, I know a lot of you on this call have already been very generous. We've highlighted our fabulous patrons and our champions. However, given the need, given the direction California is going, and given the role that we at Kappa have played, how about thinking about giving just a little bit more? Now, a little bit more, I don't know if any of you are in a position to give $5,000. That would be greatly appreciated. Even $1,000 would be wonderful. How about 250? For us, it matters, of course, the amount, but also just the number of donors, because each donor, no matter how much you give, counts towards like a vote of confidence and helps inspire us to keep on with this very challenging work. So please, I asked you, consider donating for the first time or donating a little bit more if you already have, and we will be extremely appreciative. And you can donate on the left side of your screen in Classy. There's a donate button. In the chat, you can click on the donate. And if you're on Facebook, there's in the chat, there's also a link to donate. Again, thank you so much, and please be as generous as you can. By the way, we're aware these are very hard financial times for a lot of people. So we understand if people are not in a position to give now. But for those of you who are, please be as generous as possible, and keep us in mind as you become able to give maybe even more in the future. Thank you so very, very much for your time. I now turn you over to our executive director. Thank you.
And thank you, Dr. Siebens. And thank you to all of my board members and advisors, Dr. Steve Tarzinski, Dr. Bill Tarrin, Dr. Hillary Siebens. Thank you to all of our featured speakers today. I am just so inspired to join forces. Well, we already have joined forces, but to strengthen those forces with you all and to continue fighting for a true, equitable, just, and anti-racist healthcare system. I'm sure that everyone watching this event or the recording in the near future, you are also feeling inspired. We really hope that you've enjoyed the event, and from the bottom of my heart, thank you again. I am so grateful to our event patrons. And here is a slide where you can see the name of our event patrons. And I'll give it a second more. Doris Herzog, Paula and Barry Litt, Dr. Steve Tarzinski, Dr. Hillary Siebens, Dr. Robert Benetz, Dr. Susie Baldwin, and Christopher Cherney. Thank you so much for being today's patrons. I'm also very grateful to our event champions, Dr. Bernie Nadel, Daphne Dennis, Dr. Janet Winikoff, John Lee, Dr. Duncan, Parker Duncan, Dr. Arnold Gass, Bernie Nadel, Dr. Indu Sobaya, Dr. Leslie Bruce, Bruce Hector, Patricia Silver, John Lee, Daphne Dennis, and Dr. Yelenia Palacios. Thank you so much for being our event patrons. Next, I'd like to thank our very special host committee. Our host committee comprised of volunteers and supporters who assisted in the logistics and the details of this webinar. And here are their names. Thank you, host committee. Thank you for making this event very special and for reaching out to your networks to invite them to participate today. And last but not least, I thank our Kappa staff, Jacqueline Keto, who is right here with me. She was doing everything backstage. She's here, we're here together. Thank you, Jackie. Jackie was the program, is our program coordinator at California Physicians Alliance, and she is the host. She made all of this happen. She created the page where you signed in for this event, and we did it together. Also, Yesenia Buenrostro Ramirez is our CAPSA coordinator, who was our moderator in the classy event, posting in the chat, and Bethlehem Manakalu, our coordinator of administration, was our moderator on Facebook Live, also posting in the chat. Many people have worked on putting together the details of this production to bring to you today. It would not have been possible without their diligent work and effort. Thank you so much to my team in the office. Thank you to our volunteers, our host committee, our event patrons, and our champions, our board members, our advisory members, everyone who made this event happen. With that, I conclude today's event and onward. Adelante. Vamos, sí se puede. Have a great Saturday. Take care.